Types of pressures in respiratory physiology. 1. Intrapleural pressure. 2. Intraalveolar. 3. Transpulmonary. Tidal volume is inversely proportional to which pressure? Transpulmonary pressure. Which among the three pressures is always negative, always positive? Intrapleural always negative, intraalveolar plus or negative, transpulmonary always positive. Condition when intrapleural pressure can be positive. Forceful expiration. Intraalveolar pressure values at rest, inspiration and expiration. Rest equals 0, inspiration equals negative, expiration equals positive. Which pressure is the distending or expanding pressure of lungs? Transpulmonary. Which will have more compliance and elastic recoil among emphysema and fibrosed lung? Emphysema, high compliance, expands easily but low recoil. Fibrosis, low compliance so difficult to expand but high recoil so shrinks back to normal size easily. Formula of static compliance of lung. Delta 5 delta P. Change in volume per unit pressure. Or, inflation of lung per unit pressure. Is static compliance curve same or different for inspiration and expiration? Different, and it's called as hysteresis curve. Variation in static compliance curve for obstructive diseases. Curve shifts up and left. Low elastic recoil. Variation in static compliance curve for restrictive diseases. Down and right. High elastic recoil pressure. What's dynamic compliance of lungs? Static compliance plus resistance, surface tension plus elastic recoil. Conditions where only dynamic compliance of lungs decrease. Foreign body, kink in ET tube, intrathoracic obstruction. Conditions where static and dynamic compliance of lungs decrease. Pulmonary edema, consolidation, atelectasis, pneumothorax. Total ERP, elastic recoil pressure, is contributed by ERP, lungs plus ERP, chest wall. At residual volume, ERP is contributed by chest wall. It's negative directed outwards. So inflation of lungs easy. At functional residual capacity, ERP is contributed by chest wall plus lungs. ERP equals 0. Inflation, easy. At TLC total lung capacity, ERP is contributed by chest wall plus lungs. Positive inwards. Inflation, difficult.